Now I'm going to teach you a clinical feature of a cataract. So first point is the misty vision with a distortion of vision. Patient reported in the OPD with a misty vision. And the second point, there is a loss of vision. Third, there may be a colored halos. And what could be the other cause of the colored halos? It could be a mucopurulent conjunctivitis. Second, it could be because of the acute congestive angle closure glaucoma. Now, whether it is due to a cataract or glaucoma, we need to do a Fincham test to know what we do in the Fincham test. We pass a stenopic slit is passed in front of the eye, which is seeing the halos break. So what we do in this, we just pass a stenopic slit, and if the halos gets break, it is a cataract. If it is do not, then it is a glaucoma. Next point, patient will be reported with a black spot in front of eyes, or it may be a glare. The next point, the patient may be reported to you with the uniocular diplopia or the polyopia, seen in a stage of intermittent cataract. Polyopia means, or diplopia means a object of a single object. There are two images, and if objects have a multiple images, then it is a polyopia. Next, we will see the complication, and after that, we will look for the management. Now, there is a complication of long standing cataract. If you do not treat cataract for a long time, what it can cause in the future? It can cause an uveitis, the inflammation of uveous tissues. Next, there could be a subluxation or dislocation of lens, as we see in a nuclear sclerotic cataract, or it can cause the glaucoma even. And what type of glaucoma? It is because of phacoanaphylactic. Because phaco means the lens, anaphylactic there could be a reaction of it, and phacomorphic lens could be get shape its change, and it could be a phacolytic. The lens could get break down, and it enters the anterior chamber where it can block the trabecular meshwork, and it can lead to acute angle closure glaucoma. So there could be a possibility. Next, we will look how we can manage the patient of a cataract. There are various ways we can do a surgery, like the ICCE, ECCE, and manual in small incision cataract surgery, phacoemulsification, lensectomy with anterior vitrectomy, mydriatic and optical ardectomy, ECE with PCIOL with a primary posterior capsulotomy. We will look at one by one what are these and what we do in these procedures. So let's start. Like ICCE, it is known as the intracapsular cataract extraction. In this we remove the lens along with the capsule. The method of ICC, it involves the cryoextraction, forceps method, isofake, wire vectis, and Indian split method, also called a tumbling method. The mass method is a cryoextraction, in which cryo means there is a cold environment is created around it, and we try to extract that lens out. Today, the only indication of IC is the subluxation of lens. So next we'll see ECE with PCIOL. ECC means extracapsular cataract extraction, PC means posterior capsule, IOL means intraocular lens. So what we do in this, we remove the lens behind the posterior capsule on which artificial lens is implanted. So posterior capsule from the posterior capsule side, we remove the lens and we'll place artificial lens there. Next is a manual incision, small incision cataract surgery. This is sutureless small incision cataract surgery without using a phacoprobe. Phacoprobe is an instrument which is used to degrade that cataract and sucking out that cataract from the eye. Next, phacoemulsification. It is the most common, or it is you can say it is expensive, done in major big hospitals, but it is good. So, cataract removal using phacoemulsification. In this ultrasonic pigmentation and aspiration of lens material, the tip of the phacoemulsification handpiece is composed of a hollow, approximately diameter have a diameter of about 1 mm, and titanium needle that transmit vibration at a high speed around 30,000 to 60,000 cycles per second to emulsify the cataract. These vibrations are transferred from piezoelectric or a magneto constructive crystal. Piezoelectric means electricity is produced when the particles get vibrated. So the titanium material, when electricity is passed, the titanium material get vibrated at high speed, and these are responsible for the breakdown of that cataract, and diameter is about 1 mm, from which the tip from which the aspiration of lens material take place. Next is a lensectomy with anterior vitrectomy. Lens in toto with anterior vitreous is removed, and the procedure is specially opted in children. Uh, when ICC is indicated, this lensectomy is performed, and this is because there is a strong adhesion between the posterior surface of the lens and the anterior haloid face of the vitreous, and hence any pulling can cause a retinal detachment. Next, we will look for mediatic or optical iridotomy. As clear from its name, of it is only the what is needed to remember in this. It is for the congenital stationary cataract, but now it is a more theoretical purpose, not opted for. Next, ECC with the PCIOL with primary posterior capsulectomy. Primary posterior capsulectomy is done in children as they are very prone to develop posterior capsular opacification after a few days of surgery due to intense post-operative inflammations. So, children are at very high risk of post-operative inflammation in case of eye surgeries. So, in this case, we remove the whole posterior capsular cataract. So, it is clearly written here that there is a clear chance of post-operative inflammation. So, what we do? Primary posterior capsulectomy is done in the children's. While adult, we do not remove that posterior capsule because there are less chances of post-operative illness, but it's seen in children's. Decision and needling done in congenital cataract are now obsolete procedure. So in the next video, what we will see what are the preoperative measures we take before performing an exercise.